Welcome, Clint. I am absolutely thrilled to have you on the podcast. I've been wanting to have you as a guest for a long time because you bring something so important to the table. And so many of the listeners want to do everything they can to improve their bones and their health. And what you're going to talk about today really has big implications. So welcome, welcome.
I'm thrilled to be here. Thanks for inviting me, and I look forward to our discussion.
So let's go back to the beginning. How did you even start investigating mechanical signals and bones? Like, what led you to beginning all this research and all the work that you've done?
I guess I would say that it stems from wanting to grow up to be an architect and realizing that I wasn't quite creative enough to draw and build buildings. I was very interested in how form and function sort of survived in our environment, and you look at how we understand our evolution. It's really through the fossil record. In the fossil record, it's particularly for advanced vertebrates like humans, it's bones, right? And so you look at bones, and bones are reflective of our history, not only in terms of evolutionary time, but in terms of our life. So if you're an athlete or a weightlifter or a runner or something, your bones say something very different than if you're a couch potato or if you're not particularly active. So I became interested in bone as a way to understand design in nature, and realized that bone was sort of the ultimate smart material, both in a good and a bad way, in the sense that bone is very responsive to its functional environment, its mechanical demands. So the more you demand of your bone, the more it will adapt in a robust way. But then again, if you become an astronaut and go up into space, or you decide that you're just going to watch Netflix all day long, not do much of anything, bones will actually resorb away. So to me, from understanding nature, bone is sort of the perfect candidate. But then it's also fascinating because it actually understanding how mechanical signals drive bone adaptation becomes potentially a way to treat a disease like osteoporosis.
Great, and that's so exciting because we'll get into the research, but it's just amazing how something so simple can really have such profound effects. So why don't you go a little more into how these mechanical signals play into osteoporosis, and why, as we get older or in certain situations, do they fail? Like, how does it initially keep our bones strong, and then what happens along the way?
Okay, it's a great question. Let me see if I can sort of paint a picture of bone's response to its mechanical environment. And sort of on the plus side, you look at someone like Venus Williams, or a professional tennis player, they have about 30 to 35% more bone on their playing arm, their humerus, the upper arm, than the arm that simply throws the ball in the air. And the question becomes, I mean, surely Venus Williams is out training for 6 to 8 hours per day, but it's unclear to those of us in the sort of bioengineering and biomedical disciplines of bone, is it because she hits the ball so hard, or because she practices for 8 hours a day, or maybe it's the rate at which she hits the bone? What is it about her specific demands as a tennis player that make her humerus so robust? On the other side of the equation, you take some of the healthiest people we may know of on our planet, and those are our astronauts. Their preparation for long-term space flight is pretty severe, and that's something I would want to go through. And yet, when they go up into space, they lose bone very, very rapidly. So if you put it in the context of what we as sort of normal, healthy adults, the way that we lose bone, it's around 2 to 3% per decade after the age of 35. Women following the menopause can lose as much as 2 to 3% per year in sort of the 3 to 8 years following the menopause. Astronauts are losing 2 to 3% bone per month. So you put it into that equation, what is it about astronauts? It's not suddenly are they going through the menopause once they're in space, or it's not the stress of being in space, but it's actually the absence of gravity. So taking away this weight bearing is a signal to the bone to very rapidly say, let's move it away. And so what we do in our research from a basic science viewpoint as we try to think if we were a bone cell in the neck of our femur, how is it that if I'm playing tennis against Venus Williams, in which admittedly most of the time I'd be going to pick up balls around the court because I return a serve from her, but just the same, that bone cell is somehow perceiving the mechanical challenge of loading of the hip and then responding, actually growing bone, producing matrix and making the bone more robust. On the other hand, if I'm that bone cell in the hip, this osteocyte or osteoblast on the surface of the bone, if all of a sudden I'm up in space, these cells actually signal these sort of the thugs of the skeleton, the osteoclasts, the bone-eating cells, they're recruited to resorb bone away. So it's not the sort of systemic response. It's not if you start exercising really heavily, do all the bones in your cranium start adapting and getting bigger? It tends to be a very focal response. Where the mechanical challenge is where the adaptation occurs. And so what we're interested in is what are the signals the bone cell is seeing? And then subsequently, how does it actually respond? What are the molecular cues that follow to actually recruit the appropriate cell population to grow bone? So that's what we do in our lab as a sort of a basic science approach to a very interesting evolutionary question and biomedical question.
So let's take that one step further now, because let's just delve into the research, because it's incredible. It's just, I have to just commend you, because what you did, you started studying this, and then let's just go on so we can tell everyone about the machine and the low intensity vibration and how it helps the bone, because I think people really are confused about low intensity vibration and how it helps bone. So why don't you just go with what you've seen in the research and how you developed what exists today as the low intensity vibration unit. I know that could be 10 hours, but let's just the critical point so that people understand where you've come from and how what we have today that I think that I use. I just have to say I've been using the Maradyne low intensity vibration unit since 2016, every single day for 10 minutes. And it's, my bone density it's been good.
If it's any cold comfort to your listeners, and I appreciate them listening, if it's any comfort to them, it's confusing to me as well, because the signals that we induce with this low intensity vibration are exceedingly small. So let's go back to that bone cell in the femur just for a moment.
Yeah, because I think it's important to understand the basics, because there's so many units out there and there's so many different vibration things, and everybody groups it into one thing, vibration. So I think let's clear it up for people so they understand.
So
great.
Let's see if I can do that. So in essence, when you apply a force to a material, the material deforms, right? So if you apply a force to bone as a material, the bone strains, it changes its shape. And the amount of strain, which is a unit of displacement, the amount of strain that a bone sees while you're walking down the street is around 0.1% strain, or 1,000 microstrain. And don't get caught up in the units. Just keep a hold of the sense that if you're walking down the street, the bones in your weight-bearing skeleton are deforming around 1,000 microstrain. If all of a sudden you see the bus you're trying to catch and you start running after the bus, your bones deform around 2,000 to 3,000 microstrain. Now your bone begins to break or break down at around 7,000 to 8,000 microstrain. So there's this safety factor to failure built into your bones that if you load your bones and you step into a pothole, you're still hopefully won't break your bones because you're avoiding failure. So far, the unit that's important for you to grab onto is 1,000 microstrain while walking. So I weigh 165 pounds in 1G, Earth's gravitational field. Of course, if I go to a place like Jupiter, where it's 2.5 times our gravitational field, I would weigh more, and the load in my bone would be greater. But anyway, in order for you to walk down the street, not only does your skeleton need to withstand the loads, but your muscles need to coordinate activity, right? So you're picking up your coffee cup in the morning. It's all this antagonistic and synergistic muscle activity. It allows coordination to bring your mug to your mouth. Or if podcasters or pod listeners are listening on a Friday evening, hopefully it's a glass of wine or a glass of beer. Anyway, what happens is that your muscles, it turns out, are really inefficient motors. So when they're contracting and moving that cup to your mouth, or when you're walking down the street and your muscles are contracting in your leg, not only are they contracting and applying a great force to your leg so you can move, they're actually, because they're inefficient, they vibrate, they shake. And muscles contract between 20 to 50 hertz, or 20 to 50 cycles per second. So when you are moving, even at 1 cycle per second, you're walking to the bus stop, your muscles are contracting, basically they're shaking at 20 to 50 cycles per second. What we think, and what our lab has been working on really for the past 25 years, is back to the Venus Williams question, is it because she hits the ball so hard or practices for so long? We believe that it's her muscles, and it is that shaking of the muscles that's signaling the bone cell how active the bone is. And it sounds maybe a little bizarre at first, but then you think of how you hear me change my voice, right? The tone of my voice. Or if you feel the fabric of your blouse, it's actually all from frequency sensitivity of your physiologic systems, right? You hear vibrations, you feel vibrations. So if you're an evolutionary system to pick up a system to adapt to, why not higher frequency domains? And as it turns out, because you very sagely asked the question about why does mechanical loading fail as we age? Well, it turns out that your muscles, as we age, also waste away. So there's osteoporosis, the wasting away of bone. There's also sarcopenia, the wasting away of muscle. And not only is there less muscle and more fat in your muscles as you age, I think of it as a nice marbled steak, as it were, but the type of muscle is also changing as you age. And the types of muscle that you use for posture or activity have one frequency domain that tend to waste away as you age. And so what we think is an important regulatory signal to bone, this constant, persistent, omnipresent mechanical vibration from your muscle, oscillating, shaking at 20 to 50 cycles per second. As you age, it dissolves and disappears away. And so what we thought and posed is that if you just put those back into the system, so you're now a less active 70-year-old, you're not running a marathon every day, or certainly not playing tennis against Venus Williams every day, you're not as active. But what we thought is that if we could provide a surrogate for exercise, we're not trying to displace or say we're better than exercise, but to try to become a surrogate for those missing high frequency domain muscle activity, maybe it would actually stimulate or at least maintain bone. But the important message in this is that the signals relative to what your muscle generates are quite large in that frequency domain. They're still exceedingly small. They're actually very hard to detect. So you're very nice to mention that you stand on this device every day. Turns out that my wife stands on this device every day. She loves it. She says for one thing, it makes her knees feel better. I have no idea why that is. But the important thing is that in that very brief exposure to this high frequency, very, very low intensity mechanical signal, relative to that domain, it's large to your bone cells. So we thought that if we could devise a device, this vibrating plate, stand on it, it would provide a surrogate for signals that are no longer there. And lo and behold, it seems to stimulate bone to grow. And so our research, we do everything from studying how exceedingly small signals are transmitted across the cell membrane to the nucleus to actually cause proteins to be produced, up through, we use what are called preclinical models for osteoporosis, mice or rats, or of all things in my lab, turkeys and sheep. How do these cells work in higher order mammals? And then you go up to humans. We've run a number of clinical trials to actually determine whether standing on a device for a short period of time, inducing an extremely low magnitude mechanical signal, can it prevent bone loss? And so before I get into the clinical evidence of efficacy, let me go back to your prior question about, yes, there are lots of devices out there. And I would say that many of them actually refer to our work as evidence that, well, it's based on this work from NASA. And, NASA has very kindly funded our work for many years, as has the National Institutes of Health and other sources, which we're very proud of. But over the 20, 25 years of work in our lab, tens of millions of dollars have gone into this, and which we're very grateful to the US taxpayer for developing this non-drug means of treating bone disease. The problem is that when you go to your gym and you see a device that I would describe as nothing short of being a paint shaker, you might as well go to Home Depot and stand on the paint shaker there. We believe that physiologic systems respond to vibration. But the problem with any intervention is there's such a thing as too much of a good thing. So it turns out that vibration is a really nasty pathogen as well. There's a real problem with helicopter pilots or long-term truck drivers, et cetera, that are exposed to vibrations for long periods of time. They get low back pain, they get tinny, sort of tinnitus in the ear, you get blurred vision. It can lead to percussive injuries of the brain. It can cause knee pain, back pain, as I've already said. And there's actually a big federally funded institute in Morgantown, West Virginia, Occupational Health and Safety Institute, that studies nothing but vibration, because vibration in terms of occupational health and safety is a real nasty thing to combat. So if you are a butcher that's using a handheld saw to prepare meat, you can get white finger disease. If you're driving a forklift all day, et cetera, et cetera, et cetera. And so there is something called ISO, the initials ISO 2631, which is an international standards organization advisory for human thresholds for vibration exposure. And what they do is they've created these thresholds, these maps that show how much you or I or any sort of healthy adult can reasonably expect to be exposed to vibration in the workplace. And they come up with intensity and frequency and exposure duration. And it turns out that the Meradyne device that you kindly referred to, that it's considered safe for exposure for 4 to 8 hours exposure per day.
Wow.
So, right, you're standing on the device for maybe 10 minutes.
10 minutes, that's it, yeah.
You're well within sort of a margin of safety. These devices you might run into in your gym. I mean, I think the companies are well aware that I'm not a fan. Things like PowerPlate, Galileo, these really sort of dominating sounding names, they're inducing G forces. Remember, we started with Earth has 1 G, Earth's gravitational field, 9.8 meters per second squared. You remember from your high school physics class.
Of course, we all do, right? Every listener remembers that.
Of course, everyone does. But it's just stick with 1 G. It's what makes me 165 pounds, right? 1 G, Earth's pull of me. That the Meradyne device works at 0.4 G. So if you're walking down the street, your heel strikes the pavement, you generate around 1.2 G. If you're running, maybe unless you're Usain Bolt, you're generating maybe close to 2 G. Meradyne is at 0.4 G at 30 cycles per second. So 30 times per second, you are challenged with a 0.4 G signal. All fine and good, considered safe, first do no harm. Now a power plate or a Galileo device at its low setting, and this is a message to you pod listeners considering standing on this device. At the low setting, these paint shakers generate 8 G of intensity, and at its high setting, over 15 G.
Wow.
These are considered safe by ISO standards, safe for less than 4 seconds per day. And I'm saying this, these companies would advise you to bend your knees when you stand on this device. And there's a reason for this, because you don't want to transmit this shaking to your brain, because you can cause damage to your brain. So I think that they're not malicious. I think they're well intended, and they're trying to think of how to put exercise into a very short period of time. But if it's generating G forces that your body are not used to dealing with, you might as well stand, go 10 steps up your house ladder and jump off it 10 times, 30 times a second. If you can do that, imagine how your knees actually feel. I mean, not particularly good. So I'm not aware of any evidence that shows the basic science mechanism for dealing with a G-force of that intensity. And I would say, again, I'm not here to sell people devices one way or the other, or talk you out of standing on a power plate. Please talk to your physician first. But at 10 G, it's something to consider. Do the benefits outweigh the consequences? I would say, you're asking me, not a chance. I think that there's too much evidence that high magnitude vibration is very, very dangerous to you. And by high magnitude, I mean things above 1 G. And I would say that things below 1 G, as it turns out, like the Meradyne device, are considered safe for long periods of time. So because we want to see our science translate to the clinic, and as I promised, talking about clinical trials, our goal, because we aren't out to treat Venus Williams, she's healthy enough as it is, for sure, we're actually going to the people who are suffering, those who are infirm or elderly or can't move around or in the ICU, et cetera, those that are no longer loading their skeleton. How does this surrogate come back in and provide a signal that otherwise is not there? So we have studies ranging from kids with Duchenne's or kids with, combating cerebral palsy, kids that are recovering from cancer treatment. All these conditions sort of in parallel may be poisoning the skeleton, not necessarily because of the disease, but because they're no longer particularly active. So can we come up with a natural strategy, a non-drug strategy to exploit or leverage your body's sensitivity to mechanical signals? We can't ask a cancer survivor to go out and run a marathon each day, but perhaps we can ask them to stand on a device for 10 minutes per day, so long as it causes no harm. And that's sort of been the basis of our clinical studies. Some of our studies have worked very, very well, and we're really excited by. And some of them are not, have results that are not as robust as we might have hypothesized we would. So we try to understand the science of why they didn't work.
And it's interesting because I know the cerebral palsy and the kids studies are really great results, and the animal models I've seen the pictures of actually the cells, what happens after using the device. My question is, do you think part of it is compliance? Because I know in order for it to work, you need to be on it every day. And do you think that might have been one of the issues with some of the?
Right. I mean, as before we were joined or being recorded, you shared with me that many of the people who are interested in your work are interested because you're trying to come up with your patients, your clients, your subjects are interested in non-drug strategies to prevent or treat osteoporosis. And there's good reason for that. I mean, let me remind your listeners that the FDA has approved a number of pharmacologic agents that have been shown in clinical trials to prevent or treat osteoporosis, either anabolic agents or anti-resorptive agents. And these are good drugs, but like any good things, there's no such thing as a free lunch, right? There are sort of long-term potential consequences of using them. And so people who are looking at osteoporosis and having to, let's say you're 55, 60 years old and you have a low T-score and you're looking at, you want to live for the next 40 years or so, you don't want to have to take a drug for the next 40 years to prevent the disease. So are there other strategies to come up with it? Exercise, sunlight, vitamin D, eating right, calcium, all these sorts of things. Having parents with good genes, of course, always helps. But one of the complications with prescribing anti-resorptive or anabolic agents for the treatment of osteoporosis, people don't like taking them. And so compliance, even with pharmacologic strategies, is haunted by poor compliance. They only work if you use the drugs. So back to buzzing, as I call it, standing on this plate that looks like a pizza box and getting buzzed, because that's how people describe it to me. Gee, I felt this little buzz. So if you're saying this device getting buzzed and you're doing it once per day, our studies show that your mechanical response to signals is transient. So you have to keep doing it. If you go and you stand on a device once and look at your bone a year from now, chances are it didn't have an effect. We're interested in how often per day, which is kind of interesting in and of itself, how often per day or how often per week we actually have to stand this device. So we turn, because it's very difficult and time-consuming and extremely expensive to do clinical trials, we do a lot of our studies on cells, and I have a number of collaborations. One of the sort of my most enjoyable collaborations, turns out, is with my sister, who's a professor of endocrinology at University of North Carolina, Janet Rubin, who's a hardcore cell biologist as well. And in studies in collaboration with her, she's able to show that exposing these bone cells, or actually these stem cells, which we can talk about if you have the patients, these stem cells can perceive these low intensity vibrations and they adapt almost in real time. Within an hour, their cytoskeletal structure, how the cells are actually formed, has adapted and is more robust, how it attaches to its substrate or how the membrane attaches to the nucleus is actually adapted and is stronger. The complication is that 24 hours later, the cell is resorted back to where it was before the buzzing began. So you have to keep doing it, right? You stimulate the cell to adapt, it becomes more robust. As it turns out, if you stimulate it again, let's say 3 hours later, because it's more attuned to its environment, because of its transient adaptations, it responds even better. The complication comes back to your original question of compliance. It's very easy to be a compliant cell because there are incubators. We pull them out a couple of times a day, and they're very, very good citizens, right? They're happy for us to study them. But if you're in a clinical trial telling Mr. Smith or Mrs. Jones to stand on a device, oh, gee, we're interested in what happens if you stand on a device 4 times per day. They say, well, Clint, well, Dr. Rubin, this is too much of demand, too much, just gets in the way, and compliance ironically falls. So even though we show that you get a better response, people are less compliant in following the schedule. So at least once per day, because you want to take advantage of this transient adaptation in the cells. Any less than that, then the cells sort of resort back to their hibernating state. But more than once per day, again, what's called a refractory period or a rest period, let's say that rather than one 10-minute period per day, 2 5-minute periods per day, let's say when you brush your teeth in the morning and brush your teeth at night, you stand on the device while you do this, you actually begin to ratchet up the response. So many of our clinical trials are now designed around twice per day, because 3 times per day is too crazy. But we have shown, not that it's particularly germane to osteoporosis treatment per se, but in the bioprocessing industry where you have cells that are engines for creating things like insulin or antibodies for like COVID, et cetera. One of the problems is how do you increase protein yield from these bioprocessing stills? Well, we can actually train the still itself, the incubator itself, to cause the cells to be more productive. So there's a sort of a bit of a reach from treating osteoporosis to making Budweiser beer more quickly, but it's all because cells are responding more quickly. So
Wow.
compliance is key. So long answer to your very short question. Our studies show that, and probably the best example of this is in a study in collaboration with Vicente Gilsons at USC Children's Hospital in young women the ages of 16 to 20 who were in the lowest quartile of bone mineral density and had a fracture. That was our inclusion criteria. They stood on the device for a year compared to a control group which did not. And as any teenager would be quick to tell you, some of them are very compliant, setting a device for 10 minutes per day, each day for the course of the year, and some are less compliant. That if you stood on the device for between 2 to 10 minutes per day, on average over the course of the year, you got not only a very robust response in your spine and your hip, but in the muscles of your spine, because your muscles are adaptive organs as well. But below 2 minutes was no better than control. So compliance is essential.
The interesting thing is when we take this out of the research and into the clinic, because I've been working, as I said, I've had mine since 2016, and I've had patients I've worked with and clients. It's easy. I mean, seriously, I have mine in my, it's funny, I can't imagine, I have to be honest with you, I cannot imagine having this in the bathroom while you're brushing your teeth. I really can't.
Yeah.
But I have mine in the family room and where my TV is. So it's just a habit for 10 minutes. You stand on, it's comfortable. I can talk, I can do anything. It's really, once people try it, I think they're shocked with how, that it's doing something. They're like, are you kidding that this could be so profound? Because it's so easy. It's almost like too good to be true. I have to be honest with you, because, and again, as I agree, it's not just, you can't just, in my mind, you do everything. So this is part of a complete program. It's this exercise, nutrition, finding out if there's a root cause, the whole gamut, reducing your stress, just as you said. But this piece is easy. The compliance to me is to stand on it. You can watch TV, you can do anything. It's probably one of the easiest things. It's much easier than exercising. And I love exercising. Right. It's just simple. But I think people, when they're not in the research and they want to help themselves, they're very motivated. And so the 10 minutes just becomes, no big deal. And you sort of get it into your routine. Or some people do mindfulness on it. They do their deep breathing. Everybody has their own thing that they do on it. But I have found that with people I work with, not with, I'm not doing clinical research, the compliance is easy though, because it's easy to fit into your life. Yeah.
I think that the people that have used the device are using it because they're interested in sort of a complete strategy to protecting their skeleton, or I would say their musculoskeletal system, their muscle and their bone. And again, my favorite subject is my wife, as I mentioned early on, and she actually enjoys sitting out. She finds it comfortable. She's a devout runner, and she comes home from running, she stands on the device. she watches TV or she talks on the phone. And as you point out, it is very, very gentle. I mean, these higher magnitude devices that you find in gyms, I don't think you're watching TV or talking
Oh,
on the phone,
no.
holding on for dear life. But if you can basically accept that it's sort of as a 10-minute time to reflect or to catch up with a Seinfeld episode or to speak to your son or your mom or whatever, you can actually integrate it into your daily lifestyle. And again, my wife, she does it every single day. My mother-in-law, who unfortunately we lost not so long ago, but she had frank osteoporosis. She was actually compromised for a number of reasons. And her caregivers actually stood her on her device because her geriatrician was really worried about her bone loss, but because we were fighting a number of other things simultaneously, didn't want to actually put in parallel a drug cocktail to treat the bone, stood her on this device, and she increased, it's probably the best response I've ever seen, but some crazy number like 13% over the course of a year. And of course, it's easier to gain bone if you're way low than if you're Arnold Schwarzenegger with probably a huge, robust skeleton. If you are a healthy young adult without any element of musculoskeletal risk, chances are staying in this device is not going to do anything because you're doing everything you need to do to protect your skeleton anyway. It's really designed for those that want this sort of complete strategy as part of healthy living, eating right, again, exercise, good genes, etc. It sort of weaves into this very nicely. But in particular, if you're compromised, if you're fighting chronic illnesses or you're sort of fighting sort of an underlying condition, diabetes, obesity, et cetera, and you can't be as mobile as you might want, this might be a way of, if I could be so cavalier, is saying is tricking your skeleton into thinking that it's active. And these are things we see with, if you think of a cell as an exercising cell or a sedentary cell, or mice or rats or sheep or humans, etc. We have never actually seen, in probably the more than a dozen clinical trials that we've run, ranging in kids with Duchenne's up to the frail elderly, we have never had to report to the FDA a serious adverse event, which I'm very proud of. That it hasn't worked every time, and nor would you expect in medicine for it to work every time. But to not ever having done any harm, I think is somewhat comforting to me.
Good. There's 2 points I want to make sure we address. Number
Yeah, go
one,
for it.
I think this is so important because this is something most people don't know about the mesenchymal stem cells and what happens and their options. Because I think when people hear this, it makes so much sense. So why don't you explain how this device actually can affect, and you've seen this in your research.
Right. So I started off with your podcast talking about these osteoblasts, these osteocytes, and these osteoclasts. These are what we consider the sort of suite of bone cells, right? These are the bone producers or the bone eaters. They actually come from stem cells, and these stem cells are primarily in your bone marrow. And in your bone marrow are 2 principal types of stem cells. There are hematopoietic stem cells that create essentially your immune system, your T and your B cells, and they create macrophages like osteoclasts, right? So your hematopoietic stem cells are the progenitor, or that's where osteoclasts come from. And also in your bone marrow is the mesenchymal stem cell, and MSCs, because mesenchymal is hard to say, for me anyway. These MSCs are pluripotent. They can become many different things when they grow up. So when they differentiate, when they're signaled to become something else, they can become bone cells, osteoblasts. Oh, well, they can become cartilage cells. They can become tendon cells. They can become muscle cells. Actually, satellite cells become muscle cells. But it turns out they can also become fat cells, something called an adipocyte. So an MSC can differentiate into a bone cell if signaled appropriately and grow your bone. But if it's not signaled to become a bone cell, chances are it's either going to hibernate in your marrow or it's going to be stimulated to become something else. And more often than not, particularly as we are adults, your MSCs differentiate into fat cells. And it's one of the reasons. So think of osteoporosis as a bone wasting disease. As we get older and older, after the age of 35, we have less and less bone. What is it that we have more of and that we're all aghast at? Is we have more and more fat. So not only is there less bone, but there's more fat, not only in your visceral cavity around your lungs and your heart and your spleen and your kidney and your liver, but under your skin, that horrible, sort of love handles or whatever you want. And also it turns out there's more fat in your marrow. So when you're young, a kid or a teenager, your marrow is really pretty red, as it turned out, because it's full of blood and it's very viable. It's sort of the old adage why a kid who breaks their arm basically heals by the time they get the emergency room, because it's very quick to recruit these bone cells from your bone marrow that are important to healing. As we age, and as your marrow cavity, this reservoir of stem cells, starts turning to fat rather than this viable pool of stem cells, it's harder to recruit them. It takes longer. There are fewer of them. So what we have found in our research, our cell work and our animal work, is that not only is it true that unstimulated, these MSCs have a bias towards turning to fat cells, these adipocytes. But if you mechanically challenge them, one of the reasons Venus Williams is so thin is that not only is she exercising and consuming calories, but she's not allowing those stem cells to become fat cells. She's driving them all to become muscle and bone. So we have found in our animal studies that standing on this device, even feeding these mice a very high fat diet. So you think of the mouse version of a McDonald's meal every day. So they would become obese. That in reality, if you feed them this high fat diet and you stand them on this device, you don't need to tell them stand on a device. It turns out that their little nest is on the device and we turn on the device underneath their nest. So they don't even change their behavior. If you do this once per day, then not only do they build their bone and not only do they build their muscle, they actually don't grow fat. So they're driving their stem cells to become bone and muscle rather than fat. So thinking way down the road for where our work is going and where we hope a device like MariDyne might be consequential as we're thinking about, epidemics, not like COVID, a pandemic, of course, is important that we figure out how to deal with that. But other pandemics we're dealing with is the obesity crisis in America. And that is, it's largely because we're less active than we used to. It's largely because of fast food. It's largely because we're eating more calories than we're burning off. So we are actually stimulating, we're creating an environment in our body. All these hormones, all these signaling factors, all these cytokines are driving stem cells to become fat cells rather than bone and muscle cells, that we think that perhaps, and we actually have clinical evidence that this might turn out to be true, that we can drive the process, the adaptation of these stem cells in humans to become less fat and more bone and muscle, as it turns out.
Yeah, how unbelievable. And even just with the bone, the fact that the bone is having more of the osteoblasts and less of the fat, I think that's incredible.
Right. So,
and, yeah.
Right. So it is important, that we take for granted the osteoblast. So as adults, so you and I, and probably most of your listeners are, hopefully everyone's a healthy adult. You kids shouldn't be listening. That you healthy adults, that you don't really have a whole lot of active osteoblasts going on. Maybe 5% of your bone is turning over at any given point in time. So your bone cells are actually pretty quiescent. And so if you do start deciding you want to exercise and go out and train up for a marathon, you have to recruit those bone cells from somewhere. You're recruiting them from your bone marrow. So we think that if you're going to create this sort of army of bone cells to fight osteoporosis, you can either recruit them from the quiescent population that's already there and snoozing away, or you can recruit them from the MSC pool, which is close to infinite at some point in time, and create a whole new battalion of bone cells to help you fight disease.
Wow, that's so great. There's so many things I want to ask you. We could go on for hours, but one other I think important concept that people need to know, because everybody's so concerned about their bone density, but that's only one part of it. Another thing that the unit does is help the bone quality. And I think that's, if you want to just speak to that, because that's so many people, oh, my bone density's improved, but two people with the same bone density can have very different bone quality, and that's going to completely affect their ability to fall and fracture and their health.
Right, it's a subtle distinction, but it's a very, very important distinction. So your bone is comprised of two principal types. Cortical bone, think of the long shaft of your femur or your tibia, your thigh bone or your shin bone. What you feel when you feel your shin, that's cortical bone. That's the periosteal surface of your cortical bone. Towards the ends of the bone, the epiphyses of the bone, or towards the end, as they flare out, the metaphyses of the bone, within the cortical shell is trabecular bone. So now think of your femoral neck, that thing that sort of is always at risk of fracturing if you slip and fall, or your vertebrae, your spine segments, where there is the cortical shell, but within it, what really holds it up are the trabeculae, the trabecular struts within the cortical shell, that they have a lot of surface area relative to cortical bone, right? And there's lots of available space for those thugs, the osteoclasts, to come in and perforate the trabeculae, certainly to cause your cortical bone osteoporosis, cause pores within the bone. But where your bone quality really descends is when the trabeculae start being perforated and break down. Because once that bridge, that strut is broken, interrupted, it's very hard to re-bridge it, right? So what you really want is you want to keep your trabeculae intact. And so what might happen is that as you age and you're losing bone density, one of the first things to go are your trabecular elements in your epiphyses and your metaphyses. And these are the sorts of things that you want to protect. So even though it's overall much less of the total amount of bone that you have, its role in providing the structural quality, the quality versus quantity, is very, very much there. So you certainly, if your listeners take home any message, it's to remain active, not overactive. Don't go and take a flight to Jupiter because you think gravity is good for you, because the flight will nail you. But that you want to preserve your bone. So if you're 45 years old and you have a low T-score, it doesn't necessarily, I'm not your physician, I'm not giving you a strategy, but it is a conversation you need to have with the people who are helping you with your bone to remember that it is a rate of bone loss you need to really be concerned about. So if you have a low T-score in your hip or spine, schedule an appointment a year or 2 years out, try to change your lifestyle and see if you can slow down the loss or identify the amount of loss that you have. Remember that there are FDA-approved drugs for treating osteoporosis, but I fully appreciate people's hesitation for taking them. And to your point, that these drugs really target bone, they're bone-specific agents, but osteoporosis is this sort of like system. You fail because your muscles are weak and your perception is compromised and your bone is compromised. So your musculoskeletal and your neuromuscular system is all degrading as you become aged and frail. And so what you want is you want a strategy that treats all these systems, your perception of movement, your balance. We have evidence that shows the Sanus device actually preserves, if not improves, balance, which is exciting because it's stimulating your muscle. And the more stable or the less unstable you are, double negative, the less chance you have to fall. And it's the falling is often where you break the bone. So take a belt and suspenders approach to preventing osteoporosis.
Wow, this thing, I just want to talk for just a minute about my personal experience on this, because years ago I was at a convention and they had this device, and a couple of therapists that I was with bought it and I didn't. And a couple of years later, they're like, oh my gosh, my bone density's increased. This is great. I've been using it with my patients. So that's at the point that I ended up getting my device. But what I've seen
Well,
is that
bravo for you.
people,
Yes.
what I have found, for me, my bone density has increased a little since I started this, but back in 2016. So the fact that it's even improved is, I think, quite good. But in terms of what I've seen with patients and people I've worked with, is that with everything, so I can't say it's just the machine because I'm not doing clinical trials, but that people are able to improve their bone density and stay healthy and active, and they're even better. So I always look at osteoporosis as that there's a silver lining, and that once you start doing all these things, so many things improve. But I have to thank you because this device is so easy, and it just is a wonderful part of the whole program, and that you've done so much research. And I hear now you're working with Belinda Beck in Australia. This is going to be incredible, this study where they're looking, right? You're looking at exercise.
Yeah.
You're looking at the device. It's called the Vibmore study, right? You're looking at
Yeah.
the device, because she did a big study on, exercise,
Right.
which had wonderful results. But the fact that you're looking at exercise plus the vibration, the low intensity vibration. So I can't wait to see. This is really fantastic.
Yeah,
And
we're
I
really
know,
excited.
but thank you for all the work you do. But I wanted to tell everyone, because I did speak to Macrodyne, and they're willing to give everyone who's interested a 10% discount on the unit if they just, so here's a code. I'll put this in if they put, you can call, it's an email. So it's support@copahealth.us. So if you write there, you can get more information. And you can also, if you use the code LIV, because that's the name of the unit, so it's low intensity vibration, LIV10, and all capitals, you will, just tell them that, and they will give you a 10% discount up until the end of August. So I think that's exciting. For anyone that's interested, I would definitely recommend contacting them. They'll send you information, because to me, it's a win-win. It really is. There's no negatives. It's safe, it's easy, and it's just it's not that I would only do this, of course, but it's an easy part of a comprehensive program. And that's why I wanted you on. And I'm so happy you explained the difference, because people don't understand. And just to clarify it for everybody so that they can know that there is something else they can add to their program that is not medication, and that just can complement everything else that they're doing. So, and you're the source. So thank you you've worked really, really hard, many, many years with this concept, but turning it into a device that's helping people and helping children and people with cancer. You should just feel so good about the work that you've done. So thank you, because you're really helping
Yeah,
all
well,
of us.
thank you. Thank you for having me on. Thank you to your listeners, those that have stuck with us. Let me, if I may, because it's important, it is sort of a scientist's dream to see your basic science, convert into a technology that can become a therapeutic that may help people. And I'm very, very proud to see that a company like Maradyne has licensed the technology. Please note that, there is a conflict of interest because I have intellectual property around it. I want to declare that. I'm very, very proud of the work that we've done, and I stand behind it 100%. But, I do, as much as I try to be an unbiased scientist, I become so excited by the results that I'm seeing that I don't want people to think that I don't remember that there is the conflict in there. So thank you for your patience with that. And I just hope people, I'm happy to provide the dozens, the tens, the many, many papers that we've published on this. Finally, somebody will read them. It'll be great. So we're really happy that this scientific literature is out there for people to see.
Oh, well, thank you again. It's been such a pleasure. And thank you for all the research you continue to do and make a
All
difference.
right.
Bye-bye.
Thanks so much.